Hi everyone, it's me Lazy. I'm back with another video. I hope you all are staying safe, healthy, and happy. So today I'm just doing a quick video on HIV awareness and HIV medicine and HIV PrEP medicine. I just saw that they are freaking literally restricting medicine in Dallas, Texas. And I knew this was going to happen. I had a feeling this was going to happen because a couple months ago I was talking with my mother saying these cases is getting higher. Every time I turn around, somebody got HIV. And it just seemed like people are normalizing it because you can take a pill and be undetectable. And just because you're undetectable doesn't mean you can't pass it. That's bullcrap. So anyway, I'm like, what if they start cutting off people medicine and then they can't take their medicine? Then people are just going to get sicker and, croak. She's like, no, they can't do that. That's illegal. It'd be a big old lawsuit. But it's happening. They did it in Dallas, Texas. People can't get their PrEP. Some people can't get their medicine to, keep their HIV treatable. Or treated, whatever you want to call it. But anyway, I don't know. I'm going to let y'all watch these videos and let y'all see. But for real, please be safe. Wrap it up. Go get tested. I can't even say get married because people be cheating in their marriage, so you can't even say that. But yeah, I'm wishing the best for you. God bless.
I need you to go back and watch this stitch. I have been waiting on this. I have been saying this for months, that it was going to try to cut the funding for HIV and AIDS medication. But no, you dummies, still out here busting it wide open to any motherfucking...
So late last year, the pharmacy rules in Texas changed, and they are no longer required to carry HIV and HIV preventative medication anymore. And over the past year, they have been slowly pulling it from their pharmacies without any warning to the patients. And I need you to understand something. When I was 8 years old, in the early 90s, one day, we had all 500 of us piled into the auditorium just so that one 19-year-old boy from across the country could stand in front of us and explain to us that he was going to die one day because of a blood transfusion he got as an infant. And that even though he was going to die from this one day, people still thought that they could not hug him, hold his hand, show him physical affection. They didn't know anything about his disease except that they could probably catch it. So this 19-year-old dying boy spent all of his time going to every school he could get permission to in the United States to explain to people that he deserved love and that no, we couldn't catch it from him. The early 90s, and we were only just destigmatizing AIDS and HIV. 20 years ago, this syndrome was a death sentence. For every 10 people who caught it, 9 of them died. You've seen the pictures of the choir where they're all wearing black and only 3 are in white. You're musical theater nerds. You've seen Angels in America. You've met people every day in your life who have HIV and AIDS. And 20 years ago, it was going to kill him. Today, they are undetectable, and they are capable of not spreading it through direct contact. I'm explaining it this way because I'm young. I'm young by most standards, and people younger than me might not realize this. Just like I'm unfamiliar with polio. I did not get a chance to see the devastation that polio caused because by the time I was born in the late 80s, we had vaccines. Nobody's really touched by polio like that anymore. I genuinely never thought that I would see anything close to treatment in my lifetime, let alone something similar to, not a cure, obviously, but like people live, they survive with this, and they live good, strong, healthy lives now. We're going back to AIDS kills people? It doesn't have to be that way.
So, because of the drama of y'all always wanting to be in people's bedrooms politically, right? You want to legally be in the rights of who people are fucking and how they're doing it, right? You want to control birth control, PrEP, the ability to divorce, like, come on. Okay, this is where we're at. This is where we're at. HIV medications and PrEP are being restricted, apparently, at certain pharmacies. So it's going to be a lot harder for people on HIV medications and on PrEP to get the medication they need. What does this mean? One, it means that a lot of treatable symptoms that people have, like, before people used to be like so scared about HIV, and then now everybody's like, oh, well, it's fine, like you can still live. They're trying to make it where it's harder for you to live with HIV. So we're going back to the way things were before we had treatment, even though we have treatment. So it's cruelty. Two, that means that now that people have gotten more comfortable with, it doesn't really matter what I do as long as I take certain precautions, we are now making it harder for them to go about living their daily lives, right? Which means that there's probably going to be an uptick, just being honest, in HIV cases, okay? So, be aware of this and how it is going to impact the outer environment. And y'all should be a lot more careful right now with just protecting yourself, because they are trying to create a chaotic environment for the rest of y'all. Okay?
We are not talking enough about how HIV prevention is getting harder to access while politicians debate subsidies. Public health organizations are warning, again, that patients are running into barriers getting PrEP. So, this is the medication that prevents HIV, and this is not about the science. PrEP works. The problem here is access. With uncertainty around Affordable Care Act subsidies, patients are facing higher out-of-pocket costs, insurance delays, and pharmacy hurdles. Some people are skipping refills. Others are never able to start. Prevention only works if people can consistently get the medication. So, from a clinical and public health perspective, this is dangerous. Gaps in prevention lead to higher transmission rates, higher long-term healthcare costs, and preventable harm, especially in communities that already faced healthcare inequities. Community clinics and primary care providers are already reporting patients falling through the cracks. So this is not hypothetical. This is happening in real time. If prevention depends on stable coverage, stable pharmacies, and stable policy, then instability itself becomes a health risk. We keep saying prevention saves lives and saves money, but policy decisions continue to undermine access. This is not about personal responsibility. This is about system responsibility.
Tonight, I found out that my local CVS in Arlington, Texas no longer carries HIV prevention or HIV treatment medication because of RFK's new mandates. They didn't text, they didn't email, they didn't warn me. For 2 weeks, my Discovery said on the way in the app, even though they already knew they'd pulled it. I took my last pill this morning. I can drive to downtown Dallas tomorrow to pick mine up, but what about the people who can't? People without cars, without gas money, without time off work, without the emotional bandwidth to fight through a pharmacy that won't even tell you that your meds are gone. That's who I'm thinking about tonight. This is how rights disappear, y'all, quietly, pharmacy by pharmacy. So please, call your pharmacy, check your refills, and share this video. People need to know this is happening right now. What timeline are we fucking on? Are we done yet?
Shaming people for their sexual habits isn't going to reduce HIV, okay? The number of stories that I've come upon where women got HIV from somebody that they married who had HIV before they got married, okay? And it's always something like, this person was like a really innocent, non-promiscuous person, right? Who got into a relationship with someone wanting marriage and a family. And because of the shame, the stigma of HIV, the person who has it tells no one. Their family members also don't tell. The family members are aware that this person has HIV, but because they're more concerned about the shame of people knowing it than the actual real life consequences of spreading HIV to a partner who is not aware, nobody says anything. Oh, and then the legal system protects the person with the HIV, so they don't even have to tell the person that they're getting married to that they have it. This has happened multiple times. They didn't catch HIV because they were being promiscuous. They caught HIV because the shame around it silenced the people around them that could tell them the information that would actually save their lives, right? It's the same thing that happens with rape and molestation and homosexuality, right? Y'all shame people so much. You shame the act of talking about these things, right? I'm going to shame the fact that you were raped rather than shaming the rapist. So the rapist continues to rape because nobody wants to discuss rape, right? It's the same reason why so many Republicans that say they can't stand gay people are on Grindr, right? The shame of being a homosexual is what forces them to engage in these like down low culture aspects, right? This shame, the shame that you're putting in this comment, this is what creates the environment where people are constantly lying about their sexuality. And because they're lying about their sexuality, they're expressing it in a lot more riskier behavior because they can't be upfront about it. Where if you remove the shame, they could just be more open and honest. And if they could be more open and honest, then we'd be able to prevent a lot of the shit that goes on, right? But as long as you keep pretending like it ain't gay people in your church, like it ain't gay people around here pretending like they in marriages that they don't even want to be in, until you stop that, until you stop trying to use morality to police real life situations, you're always going to have people lying about who they really are. And because they're lying about who they really are, whether you're promiscuous or not, they're putting everybody's lives at risk. Okay? This doesn't help anything. This helps no one. Like, keep that shame to yourself.